Welcome to today's HIMSS20 virtual lightning session presentation, The Single Patient View, Bringing Payer and Provider Data into Focus. Your speakers today are Kristen Weir, Senior Vice President, Product Management of MediAnalytics, and Andrea Sorensen, Associate Vice President, Product Consulting of MediAnalytics. Before I turn things over to Andrea, I'd like to go over a couple of housekeeping items. This webinar is being recorded and will be available for replay next week. All attendees will be on mute for the entirety of the webinar. If you have a question, please submit them via the Q&A text box to the right of the screen at any time during the presentation, and we will address them during the Q&A portion at the end. As a follow-up to today's presentation, you will also receive an email that includes a PDF of today's presentation and recording. Thank you so much for joining us, and with that, Andrea will start today's presentation.
Hello, everyone, and thank you for attending our HIMSS Lightning Session presentation today. I'm really excited to be here with you. Again, as said, my name is Andrea Sorensen, and I'm our AVP of MediAnalytics Product Consulting Team. Today, I'm joined with Kristen Weir, the Senior VP of the Product Team. We are glad you're able to take some time out of your busy days to listen to our session.
At MediAnalytics, we provide services to both the payer market and the provider market. And what we found is one of the most important topics that come up in our discussions with our clients is the need to have a single patient view. Improving patient outcomes with a holistic view of patient and optimizing finances have to be the two most fundamental focus areas that payers and providers can accomplish by jointly working together. What's better, they can both significantly reduce time consumption and resources needed to achieve that goal. So we're going to share some insights around this collaboration in today's session.
As you can see, there are times where Kristen and I may not agree, and we battle out our differences in the ring. She is leading product, focused on driving her team to create products to meet the market and industry demands.
But Andrea is focusing on right-hooking a deal from a sales perspective or engaging the clients with a solutioning session. And I've even had Andrea come back to my team and tell me that we need to add to our product solutions. Now, sometimes I agree with her, but sometimes we are just not on the same page. But as you can see, we always have a smile on our face while we work through our differences. And Andrea also knows that my right hook is pretty strong too.
The same scenario comes out at times between payers and providers. Providers are focused on trend and spend, and payers are focused on trend and spend management, utilization. All of these things are important to the providers as well, but they also have to focus on their revenue and think about how to stay in business in today's world. While there are many differences among both of these two, there are also many things they want to focus on together. For example, the patient's care, minimizing confusion for the patients, finding low-cost services in appropriate settings, finding other better options for the patients, and ensuring safety are just an example of a few. Kristen, do you agree?
Absolutely, Andrea. As you can see from the Harvard quote, a recent International Data Corporation report predicts that a 36% growth rate for healthcare data over the next 5 years. Now, that's faster than in any other industry. There is so much more data now that we all have to manage through. And everyone in the industry, payers, providers, patients, are all navigating the healthcare data spectrum. And at times, it's like navigating a data tsunami. We need to work together to focus on the right patient, the right information, the right time, the right place. And that's the adage that many of us use to describe the much sought after single patient view.
I wholeheartedly agree, Kristen. Cohesiveness and coordination of care is better when the providers and payers see the patient in the same way. All in all, this improves patient care, and patients win when providers and payers work together. So why is the single patient view so important? Well, the mission of healthcare providers and services has always been to promote and support their patients' well-being. Often they're faced with many challenges in following through on that promise. For example, sprawling healthcare systems, compromising physicians, nurses, hospitals, clinic and pharmacies, they've all always developed effective means of communication and sharing data among their disparate parts. But this can become challenging. This has produced widespread fragmentation of patient data and a lack of comprehensive patient profiles. The point of having a 360-degree view of a patient's health information and history is integral to delivering the highest quality of patient care. The lack of these integrated profiles can possibly lead to degraded health outcomes.
Absolutely. And accountable care organizations, or ACOs, are voluntary networks of healthcare providers and services that have elected to closely coordinate their patient care with one another. ACOs were born out of a new effort to incentivize and reward beneficial health outcomes and maintenance instead of simply the volume of procedures and interactions. So in other words, quality over quantity. The close coordination and sharing of patients' information within ACO networks, which can include physicians and practitioners of different specialties, hospitals, specialized clinics, labs, service centers. It allows healthcare providers to see a fuller profile of patients' medical conditions and history. This enables them to focus their efforts and resources on the most beneficial tests and treatments, while also eliminating redundant or unproductive efforts. More importantly, it allows providers to coordinate their treatments so together they can offer patients more holistic care that better promotes patients' integral health and well-being. But this really hinges on the ability of healthcare providers and services to assemble and share a comprehensive 360-degree patient profile. So increasingly, this is in the form of electronic health records. And when third-party applications are anchored to a singular platform and connected to a patient's EHR, clinicians gain a full view of the patient's longitudinal record, including behavioral data, socioeconomic data, and more. Now, that's why data-driven analytics may be what everyone is thinking today, but what we should really all be thinking about is patient-driven analytics as the foundation for healthier, happier, and more engaged patients. This should be the ultimate destination where analytics is heading in the future. So have Andrea talk about why this can be challenging.
Yeah, there's a multitude of things that can cause challenges in this arena. Outdated and inflexible legacy systems, which are especially difficult to integrate. They can aggravate the problem by preventing efficient data sharing and creating data silos that isolate the patient information. At the same time, the vast explosion of new technologies and treatments, from new diagnostic methods and monitoring equipment and applications to new surgical methods and even all of the new groundbreaking drugs. These have all vastly expanded the typical patient interactions of the healthcare system, and it's added difficulty in identifying and managing all the different pieces of information associated with a patient. For example, the multitude of different providers that a patient sees, all the different services that they have, all the different devices that are gathering information about those patients. All that data is going into databases contain all sorts of disparate patient data that have to be aggregated into that single patient view that you were talking about, Kristen. Moreover, all the numerous data types have to follow the HL7 standards in order to transfer the data between healthcare systems. For this to happen, a healthcare's network various systems need to be seamlessly integrated. And this integration can be complex, such as taking two totally different systems and merging them together and merging that data together, or even the simplest tasks, like determining names, can cause this issue. So if you look at the example on the right-hand side, I'm going to walk you through a pretty simple example, and it seems simple, where let's take Kristen and I. Let's say we're the same person, and Kristen is going to the doctor. She's known her doctor for years. She knows the office staff for years. And when she fills out her paperwork at the doctor's office, she puts her name down as Liz, right? So what happens then is Liz, or Kristen, for this example, forgot that when she filled out her information on her application for the payer, she put her full legal name of Elizabeth. Well, Liz and Elizabeth, as you know, or surnames can be used all the time. There's many different names that can have this situation. But when we get the data from a payer and from a provider, and we have this example of Liz and Elizabeth, the question is, for that system, whose data takes precedence? Is it the payer data? And then all the data that had Liz is merged together with Elizabeth? Or is it the provider's data is coming in as primary, and so her name is Liz? There's a multitude of things that have to be researched, such as to make sure that's the same person, because you don't want to put two people together that are not.
Exactly, Andrea. That can actually be a painful experience on the patient side, speaking from experience. So how do we solve this? Today, we as the healthcare industry need the ability to pull all this vast amount of information together from the payer and from the provider, such as all member enrollment and claims data from the payer side and patient account and charge data from the provider side, into a consolidated patient events record. Medi Analytics has created our payer-provider core solution, where we are leveraging a single source of truth for both payer and provider to leverage. When we join the data from both sides, it allows both payers and providers to understand what's going on both sides of the coin more quickly and holistically. Our solutions create a foundational, just a common foundation, I should say, and provides better timeliness and breadth of data.
There's tons of benefits by doing this and ensuring that this linking takes place correctly. The benefit of combining the patient event detail like we do is foundational to a lot of other components that we report on, such as mortality, readmissions, HACs, and many, many other quality measures, for example, are affected positively if you have a fuller picture of the patient. Gaps in care can be reduced because the information sharing, maybe the payer has more information than the provider, but sharing that between the two, we're not trying to do redundant services. Employers, if they're a client, may see a better picture of their employees' population to focus on incentive programs all around.
Exactly, Andrea. And this payer-provider core of information allows providers to see what's going on with their patient outside the walls of their organization. It allows the payers to view the aggregated services that a patient's having outside their coverage. Other benefits, as noted in the slide, are that they gain access to a wider, more cohesive set of patient information. For example, if your patient goes on vacation and gets the coronavirus or breaks their arm, the primary provider may have no idea, but the payer is getting that information. They can also receive the member data more quickly by bypassing claim lag time. Payer lag time can be upwards of 90 days, and when it comes to their quality measures and HEDIS, being 90 days behind is very problematic. Now they have that information in 1 day versus really being behind the 8 ball, and it enables the ability to be more proactive with care plans if they can bypass that claim lag time. Third, viewing a superset of diagnosis and procedure codes from both the payer and provider. Standard formatting of claims in various payer systems can actually limit the amount of fields that can come through. So with a superset of data, we can pull the account charges and put everything that is unique into an event, accounting for any duplications because we just pull out the unique information. This provides a much more accurate view, so helping to prevent duplicative services, misdiagnoses, or misprocedures. And fourth, enabling greater information sharing and collaboration between payers and providers. This is really helping to break down the silos between payers and providers and the age-old debate on whose information or which system is correct.
And this aspect is so important for so many different roles within the payer and the provider markets. We're going to talk just about a couple views from, the chief perspective. Many times decision makers at both the payer and provider benefit from this data collaboration. For example, our first one at the top, there's a lot of information there, but I'm just going to focus on some key value realizations. The chief data analytics officers benefit from self-service analytics across their company. This helps drive the culture of data with an enterprise analytics strategy. They can gain holistic enterprise-wide insights with dashboards, predictive insights, and benchmarks, for example, for allowing patient populations which they have in common, and this helps make better decision-making.
Exactly, and someone else we talk to a lot, the chief financial officer, they need to optimize their rev cycle performance on the provider side. Having a consolidated view of data helps them pinpoint opportunities for improved efficiency and cost savings, for improved profitability and growth. And this can create a revenue stream that aligns with the goals of the organization and builds a stronger provider network for the payer. And our last example is the chief quality officer. So from the provider side, what are they dealing with? Cost pressures, the need to improve clinical and quality outcomes. Maybe they're facing the need to implement more value-based care provisions. And all of these must meet regulatory compliance from payers and government entities. They need to have a view of the patient to help them with quality scores and plan rankings. And guess what? The exact same needs are happening for the chief quality officer on the payer side. Both sides of the equation are tasked with some pretty hardy goals. So why not work together to make that happen?
So we've taken some time and put together some ideas that we think can help you take the right steps in the right direction. So first of all, define common goals. Begin collaborative work together between payers and providers. Define common goals, a common vision, and a common reward between the two of you. Agreement on risk tolerance and change management strategies are also very key components.
Okay, our second step is we'll talk about utilizing common technology. Payers and providers can use enabling technology, workflow tools, and analytics that drive good decision-making to share information. Each should be comfortable with what the other is doing.
Especially, as we've been talking about, you've got the one view between the two. It will take strategic relationships and open communication to determine the financial responsibility and even prior authorizations at point of care.
Absolutely. And our fourth and final step is finally acting as a team. With a set of leaders who are determined and have a shared vision, payers and providers can team up and partner with companies that support their collaboration.
So we have seen this as a positive outcome in our client market, where we've identified cost savings and revenue lifts and cash acceleration, as you see on the page. This does work, and we hope you've picked up several ideas today of how payers and providers can collaborate using data to evaluate, treat, and manage the utilization and the cost of a patient in a very positive manner.
Absolutely, and as Andrea said, we have seen this work in our market when our clients work together to solve some of the healthcare industry's toughest challenges. The results our clients have reported to us really say it all. If you're looking for help with, well, I should say, if you're looking for help in the ring with your payers or your providers, we can help. Medi Analytics offers a proven solution with thousands of healthcare clients who report significant ROI and are achieving success in a sometimes challenging healthcare landscape. So we hope that you have enjoyed our session today, our lightning round. Thank you for bearing with me as I'm losing my voice in true HIMSS fashion. And we invite you all to take the gloves off and have fun in the ring. I think we'll open it up to any questions.
Thank you, Kristen and Andrea. Again, as noted, if you have questions, please submit them via the Q&A text box to the right of the screen. At this point, we do have a few questions that have come in. The first question is, we're a payer and have a data governance plan. We review data integrity and quality all the time, but honestly, we're not sure providers have as much focus around this. How could this help get us on the same page with our providers?
Yeah, I'll take that one. This is Andrea. I'll try to save Kristen's voice. So I've been on that side in my career, where I was on the payer side and I was on the provider offices. And I found it extremely beneficial when, it's one of you, and most of the time I see the payers having a full-fledged data governance program in place. Share the information, communicate it to the providers. This is the whole part of setting up that communication and that collaboration between the two, in that they may not realize that their systems are, sending invalid data, or, even like that example of Liz and Elizabeth. Talk through those things so that you can make sure that you're on the same page and trying to achieve the same goals.
Perfect. Okay, just one more question. If we wanted to see demos of the product you offer, how would we do that?
That's a great question. There's a couple ways to do it. So if you go to the medianalytics.com, you can connect with us that way. When we send out the email with the information, I'll make sure that our contact information, my team actually provides the demonstrations and product consulting to our clients. So that can come back to me, and I will get someone assigned to sit down and walk you through what we can offer.
Okay, we do have one more question. Does HL7 integration help with this?
I'm assuming you're meaning the HL7 integration helping with the data governance aspect, and that's exactly right. Those edits and those things that are set up on the front end system do help. But again, I think just the complexity of the data in so many different places, again, it's not just claims data being passed back and forth. Now we're starting to take in socioeconomic data, you know, purchase data, depending on how payers are advancing, you know, even marketing strategies around healthcare analytics. I think, again, there are pieces of the environment and the structures that do help with that integration and those edits and complexities, but we're continuing to expand with so many different data sources. Having a solid data foundation in place, the data governance program, and then communicating between the two will additionally help. Great question and comment.
Right. There are no more questions, so thank you all for your participation and questions. As a reminder, we will send you a PDF and recording of today's webinar in the next week. Thank you for joining us. You may now disconnect.